Hello, everyone. I'm Amy Jones, and I'm here with Kim Sheets. She is our guest speaker tonight, and we get to learn a lot about dental health from Kim. Kim lives in Greensboro, North Carolina, and she is my personal veterinarian for all of my puppies. And we've had her for the last 10 years, but she's been a veterinarian for 30. So we're very blessed to have her speak tonight and can't wait to hear what she has to say.
Okay, so we're going to talk about teeth. So that was just all the stuff that I've done in 30 years, but mostly I do a lot of low cost spay neuter. That's been a big passion of mine. So, first of all, I want everyone to know that you don't have to know all of the things that we're going to talk about tonight to promote plaque control to your clients. It's just more of an overview of different dental diseases and some of the challenges we have as veterinarians and getting our patients to be comfortable with their teeth. So the plaque control or soft chews, they're a tasty natural supplement that any healthy dog or cat can have. So um, we'll go on to the nasty here. So this is a mouth that has been neglected for a pretty long time. So, and we'll go through the stages here. So why is oral care important? So prevention of dental disease is more than just bad breath. Basically, all of the blood that goes to your mouth picks up bacteria, and then it goes into your systemic circulation and goes to your organs. Some of the organs that are affected by dental disease are the heart, especially the heart valves. So that is why there's a lot of little dogs with bad mouths that have mitral valve disease. So that's definitely been shown to be a link in both animals and in people. Kidneys, that is another target organ. So ultimately, you can get renal failure. Dental disease is one of the leading causes of kidney failure in dogs. The liver, it also travels to the liver, which means that you can have elevations in your liver enzymes, damage to your liver. Especially, we see the alkaline phosphatase go up when we have dogs with really, really bad mouths when we're doing pre-anesthetic blood work. So a big part of dental disease is preventing pain. A lot of these dogs suffer in silence. Um, they really don't tell you that they're hurting. So hunger is a powerful motivator. So they will eat even though they have pain. I have seen dogs and cats with their mouths literally rotting and they're still eating, but I can assure you that they are in pain. So I personally had a pulpitis lasting about 8 months. And when I got really painful, I took some ibuprofen and put on my big girl panties and went to work. But I can assure you that I was in a lot of pain. So, and they don't have the option of reaching for the ibuprofen when their mouth hurts. So these are the stages of periodontal disease. And in the beginning, you'll see that there's just some redness at the gum line. In stage two, you're going to see some bone loss. Stage three, now we've got much more bone loss and quite a bit of inflammation. And at four, there's more than 50% of the bone loss, and that tooth is really gone. That tooth is painful and is no longer viable. So, how would you know if your pet is hurting? Some animals will eat and then stop eating. Some will stop eating the hard food, but will eat food if you soften it. Sometimes they'll drop the food or may eat on one side of the mouth. I see that sometimes when I'm doing exams where one side of the mouth looks really good, and then I look at the other side and there's a lot more plaque, tartar buildup. So I know that they're not chewing on that side of the mouth. There's probably a problem over there. So for cats, cats are a little strange. So they may start to eat and then run away. Of course, they may do that anyway because cats are just kind of strange. Excessive drooling, that's very common in cats with severe dental disease. And then a lot of people just think their animals are getting old because they don't feel as good. So they just kind of lying around. It's amazing when we have these dogs come in and we do take a lot of these compromised teeth, how much better they feel. And clients are like, wow, I didn't know how bad it was until my dog started feeling better. So this is an interesting cat problem. This is a gingivostomatitis, and this is a abnormal response to the plaque film on the teeth. Basically, the cat is trying to attack it, kind of like a person with allergies, where your body is attacking pollen, and it should just like not worry about the pollen. So you can see here how red everything is, and it starts around the tooth, and then it starts going up here. You can see it up here into the upper part of the gums there. So, and it's pretty bad disease. So you can also have it in the back here of the mouth. I've had people come in for second opinions where they were told that their pet had cancer, because some vets just haven't seen that in the back of the cat's mouth before, and it can get really much more prolific than this. You can see just bunches of tissue on the bottom of these mouths. Sometimes they're so bad. So these guys will typically have thick drool. It will get stuck on their fur. They will be definitely underweight and thin because they're just not able to eat until their caloric intake is met. They're just eating what they have to eat to stay alive. So when we treat this in cats, we have to suppress the immune system. So because again, it's the immune system that's causing the problem. So things like prednisone, uh, usually daily, or that's kind of been the gold standard. But they have side effects. You can gain a lot of weight. Your cat can get diabetes. It does have some negative effects over the long haul, but you have to keep the cat comfortable. So it's a compromise. Brushing the teeth of these cats is not an option. They're very painful. Rinses, again, everything that touches their mouth hurts. So it doesn't work very well either. And then the dental diets don't work because they have to chew those, and their gums are very, very painful. So what I'm hoping is that this new product will keep the plaque film down on the teeth so that the cats are not reacting to the plaque film because it's just not really there. So maybe we can start these guys earlier on this when they're young cats before they develop this disease, and maybe they don't have to have this disease. So again, most of these cats, when it gets advanced, even with steroids, it doesn't control it, and we have to take all the cheek teeth out, sometimes all the teeth out to get it under control. And even then, sometimes some of the cats need steroids to keep it truly controlled. And this is a dog issue called cups, and it's similar where the immune system, again, is being overactive and reacting to this plaque film. So you'll see this little area, and that is where the tissue is touching this area of the tooth, and it forms these ulcers. Very painful. Sometimes we'll get these guys on some steroids, some antibiotics, kind of keep it under control. Sometimes they have to have the teeth taken out to really get it under control. But keeping the plaque film down is what prevents that for these dogs that are reactive. So I'm excited to try this on those dogs as well. Here you can see where a dog has had extractions. These are little sutures which will dissolve. The dog's under anesthesia, has got an endotracheal tube in there, but they did this side and this side at one time. Usually we stage these extractions. Trying to do all of them in one sitting is a lot for the animal, and it's a very long anesthesia. So here's another unique cat problem, resorptive lesions. And these are actually holes in the tooth. This is where there is no enamel, it is gone. So everything that touches the surface of the tooth goes straight to the dentin, straight to the pulp cavity, straight to the nerve. If you were to put a probe or your fingernail right there, that cat would chatter uncontrollably. Just yeah, 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 yeah. The jaw just chatters. It's really dramatic. But these teeth are so painful. There's no filling this. There's no cleaning this. This is a hole in the tooth, and these teeth have to be extracted, which is another reason why cats do need to go to the veterinarian every year, because a lot of people don't know how to look for these in their cats, and they're going to miss them. So here's an early one right there, and this one is when it's gotten a little bit more advanced. But I've gotten pretty good at spotting these on regular annual exams, and getting these guys to come in and get these teeth out so that they can be comfortable. You can see here, this is another area of inflammation where they've got that problem going on just under their x-rays. If you take dental x-rays, you'll actually see the holes in the teeth. Um, so the challenges that we have, brushing, right? That's the gold standard. That's what everybody's going to tell you. You go to your vet, you need to brush your animal's teeth. I don't brush my dog's teeth. I don't brush my cat's teeth. I barely get time to brush my own teeth. So I'm not going to throw rocks when I live in a glass house. So I tell people, brushing just isn't really going to be something that people can commit to every day. And you have to do it every day because that plaque film hardens in 24 hours and then it's stuck on there, it's mineralized, and you're not going to brush that off anymore. So I love it when I go to PetSmart and I see the toothbrushing for $10, professional toothbrushing. I'm like, wow, brush the dog's teeth once every 6 weeks. That's really going to make a big difference. I say just put the $10 in the tip jar and call it a day. Sometimes you have a dog that's like this, a little piranha. So this dog's going to eat somebody if you try to brush his teeth. Even the client can't touch their own dog's mouth because I have dogs come in like this all the time for their annuals. And I say, can you open the dog's mouth so I can see the teeth? Because I think he's gonna eat me. And they're like, I can't touch his mouth. He's going to eat me too. So this is not a dog that you're going to be able to brush his teeth. Um, so I love these when these come in, and I'm telling them, your dog we need to scale these because they're really bad. And they're like, well, why don't I just brush them? You can't brush this off. This is not coming off with a toothbrush. So yeah, that ship sailed. So you just yeah. So to chew or not to chew, the dogs that chew usually have better teeth, but a lot of the dogs don't want to chew. They just they just don't. So for a chew to work, they actually have to chew it. Most of these work from enzymatic or mechanical chewing against the tooth to remove the plaque. Um, Sometimes there's also an ingredient like the Oravet that has the little barrier in it, but personally, one of my dogs gets sick when he eats. It messes up his stomach, so that can be a problem. Some of these chews are kind of big and they kind of sit in the digestive system. And remember when we had all the greenies a couple decades ago that weren't dissolving and they were getting actually stuck in dogs' intestines and were requiring surgery because they had blockages. To chew or not to chew again. So the dental diets, yes, to chew them is the only way that they work. And some of the dogs inhale their food. They don't even chew the food. Cats the same way. So, and then some of them don't like the taste of the dental diet. So it's only going to work if they eat it. So the plaque leads to that periodontal disease, which is what causes all that inflammation at the gum line, ultimately to the pockets and the gum recession and the bone loss. And then once the bone is sufficiently gone, the tooth is going to be loose and it's going to not be there much longer. And it's interesting to see how many dogs actually have their teeth literally rot out of their heads and the people don't even know it. You say, oh, has he had teeth removed? No, never. He's never been to the dentist. And there he is with so many teeth out because they literally rotted out. So that plaque also causes that immune system to overreact, and we can have those painful immune-mediated diseases also. And then, of course, there's the stinky dog breath, which nobody wants to have their dog smile and lick them and breathe on them when they have the stinky dog breath. So we want to reduce that plaque so that we can have good oral health and pets that are not in pain. So oral care, as far as the actual cleanings are done when needed. So it's a little different than in human medicine where we go in every 6 months, or we should go in every 6 months and have our teeth scaled and cleaned and the x-rays done, every year and all of that we get done for keeping our mouths in good shape. But because pets have to be asleep for it, we don't do it unless it's necessary to do it. And that happens when that plaque film, the tartar buildup right at the gum line. You're starting to see the that gingivitis, that reddening, that's when we tell clients it's time to clean their teeth. So wouldn't it be great if we could get them on a supplement that would get that at that early stage, prevent the advancement, and actually take some of it off so that they don't need to come in for a cleaning? So the plaque control, it works from the inside out. So it goes into the dog's bloodstream and changes the composition of the saliva, which prevents the plaque from sticking to the teeth. So, so that's kind of a novel concept, and you don't have to brush, you don't have to chew anything. It's just not going to stick. It's a natural supplement, so it comes from organic kelp, which is from the Scandinavian coastline and sustainably harvested, which I do like that. We also have some parsley in there, which helps with the breath, keeps the breath fresh, and it works for 24 hours, which is important because that's the time it takes for that plaque film to harden on the teeth. So this is something that you would do on an everyday basis. You can give it as a whole chew, or if your pet doesn't like the taste, you can crumble it and mix it into the food and it'll still work. So that's a plus because not every dog likes to eat everything. And the cats, same thing. Cats are really picky sometimes. So there is a benefit of giving this when there is already the tartar on the teeth, especially these stage 1 and 2. You will see that in 12 weeks, it will actually remove the tartar. So before now, you had to get it scaled to get any of it off. So this is really a great product. So I still think that this product would be good for your stage 3 and 4 pets. Some of them do need to have those teeth extracted, the ones that are beyond help. But if you can get that tartar off the gum line, then they will have a lot less inflammation. Some pets can't have anesthesia. They're just not good. They're just not good candidates. They're just high risk. And so reducing the plaque will definitely help them to hopefully not be as uncomfortable and have an advancement of their periodontal disease. So here are some before and afters of using the plaque away. This is, or plaque control, I keep calling it plaque away. Be gone, plaque. So you can see here these teeth on the bottom, especially the difference in the inflammation, and especially up here, that was just really amazing to see this large upper fourth premolar. Just that's about the healthiest that, I mean, you would never think it could get that healthy again after looking like that. Typically, even after cleaning, there's still pockets remaining. And it doesn't usually take long before those dogs have to have them cleaned again when they get to that stage. Here's some other good pictures. Here we've got before and after pictures. You can actually see where some of this stuff is starting to flake off, so which is really very cool because usually you can't get it to do that unless you get an instrument and actually peel that off of there. So, so that's kind of the nuts and bolts. And anybody have any dentistry questions?
We had one question, Kim, from Joey. You had mentioned that cats do a chatter when you put the
Mhm.
dental prong against their gums. Do dogs do that as well, or is that just a cat thing?
That's a cat thing. I've never seen a dog do that. I mean, they may wince or move away, but they don't do the chatter thing. So probably because dogs don't have resorptive lesions. They don't get those. So there's not holes in their teeth. So dogs typically it's periodontal disease. It's going to be that buildup around the gum line, and it's going to cause that gum recession, the pocketing, the bone loss, and then those teeth are going to die and fall out. So, but it's very painful when your teeth die. I mean, 8 months, I fought not having a root canal. Um, I just remember waking up one night just with my jaw throbbing, and I thought, well, this can't be good. So, so the tooth dies and it's painful.
And this product is good for both dogs and cats, right, Kim?
Yes, it can be used for dogs and cats. I like the fact that you can crumble it up because, again, cats sometimes won't eat a chew. They just are like, yeah, I don't know about this. So you can just crush it up and put it in their food. So that's kind of
Okay.
a nice plus.
And then Elizabeth would like to know, she writes, do you feel the kibble is a major cause for poor oral health, especially for cats, since they don't have amylase in their mouth to break down all of that starch?
So there's a lot of reasons why kibble diets are not the greatest for cats. You have the kidney folks that uh, the wet food's definitely better, higher in moisture, better for the kidneys. The carbs are typically higher in the kibble diets. So we see a lot of obesity in cats that are fed kibble diets. The cats that eat almost all canned food are usually leaner. So, and I have clients that say, well, if they're eating hard food, don't they need that to clean their teeth? But there are a lot of cats that eat nothing but hard food and they still have buildup on their teeth. So I don't find that unless it's a dental diet made specifically to break in a way that scrapes the tooth, that's the only time I think the kibble is beneficial for dental
Hmm.
disease.
Thank you. And then Christy has a question. She wrote, so even if I'm using this, I still need to take my dog to the vet for the regular cleaning, correct?
No, not necessarily. Again, the cleaning is done when it's needed. I had a
Mhm.
client the other day came in, she had him done a year ago. She's like, okay, I've got them scheduled. I looked in their mouths and I said, I don't know what you're doing, but these mouths look great. The dogs don't need to have anesthesia. They don't need to go under and have anything done. They look fabulous. So we only do it when we start to see signs of disease. So again, that is why so many veterinarians promote, brush their teeth every day. If you have a puppy, you brush his teeth every day for the rest of his life, he will never have to have his teeth cleaned. Now, he may crack a tooth, break a tooth, and still need to have a dental procedure to remove a tooth that's damaged, or you can even get a root canal done. I don't do root canals, but there are boarded veterinary dentists that do root canals. So if you have a police dog that breaks a canine tooth, they need the canine teeth to work. So they'll do a root canal and put a gold crown on it.
Excellent. I think that concludes our questions.
Okay.
Christy, did you have anything that you wanted to add?
I did see a question about the dosage, and like Joey and Brittany were saying, it does go by weight.
Mhm,
So you either give one, two, or three, choose a day, depending on how much they weigh. And
mhm,
I would want to look at the bottle to make sure I'm saying it right, but I believe 25 pounds to 50 is who
mhm.
gets two. And if
Yep.
they're below that, they get one. If they're above that, they get three.
Yep. That's true. So,
Anything? Then here's another question from Danielle Amy.
Also, washing feed and water bowls daily with hot soapy water dramatically decreases plaque. That's something to add for customers. Yes, that is true. That's also very helpful and very important.
yeah, just for hygiene.
Mm-hmm. I tell my kids, would you want to drink out of
I
that?
know it's
Wash that for
bacteria.
your puppy.
Sometimes there's a pink film in there. It gets a pink film, and my cousin,
Mm-hmm.
she said, "Oh, I think my cat's bleeding from his gums because there's pink in the bowl." I said, "No, honey, that's because you don't ever wash the bowl out. It's slimy. You just need to wash your bowl." Yep.
Wonderful. Thank you so much, Kim. This was great information.
Sure.
We're very grateful for your time to explain it to us. This was really helpful to break it down.
So, but be sure to go every year to your veterinarian because they're going to do an oral exam as part of that checkup. Check for all of this.
Absolutely. Thank you.
There's one more question that came in if we want to grab that, Amy.
Sure.
Sure, I'm not seeing it.
It's from Lorraine. Has
Oh,
this,
it just popped up. My
okay.
Wi-Fi is a little slow here. Has this been tested on intact dogs that are standing for a stud?
Well, that would be a question for Brooke, I'm assuming.
I think so. We can find that out, Lorraine.
Mhm.
We'll find out and let you know.
Mhm.
I don't want to answer and be wrong.
I don't know why it would be a problem, but